Since 2017, the development of the Daniel Baird Foundation bleed control kit, this has inspired other similar emergency trauma kits to be developed. So as well as the Daniel Baird Foundation kit, we also produce the critical injury kit, which is compliant with the British Standard First Aid standard and is used in industry and businesses a lot, where the compliance with that standard is required. Very similar kit, just a few variations on what's actually inside it. And more recently, the Enhanced Public Access Trauma Kit. This has been developed off the back of Martin's Law, which came into law in April 2025 and is going to be required by venues with between over 200 or over 800, depending on their risk assessments, to be available in case of a terrorist attack or similar. As with all emergencies, the number one thing is to take care of yourself. You shouldn't go into a dangerous environment. You need to kind of check the area is safe before you go and help a patient. It's also really, really important to remember to call 999 and make sure you've got a paramedic coming to back you up. The critical injury kits are compliant with British standard, which is 8599-1, which is basically the standard which specifies what should be in workplace first aid kits. Because of that, some workplaces' risk assessments will show that they need a critical injury kit. It's likely they're going to be superseded by the packed kits in the future, but for now there is a BS standard and there is a requirement for them. So we include the Daniel Baird Foundation body map in these just to give an overview of where the different components should be used. In most cases, these in the workplace are going to be used by trained personnel, so it's less important, but it's a bit of an aide-memoire for them. There's two of the haemostatic gauzes. These are designed to pack a really serious wound. They're impregnated with a clotting agent, so as blood comes into contact with them, it's going to start clotting instantly. The specification of these says it will clot a large wound in under 3 minutes, so it's really quick, but it will instantly start slowing down that blood flow and start the clotting process straight away. With two of these, this means you could have either 2 casualties or a casualty with more than one really serious wound. They can be used all the way up to things like amputations, where you've got a really big wound to try and pack. The Windlass tourniquet is a really simple tourniquet to use. It's used for kind of lower arm and leg injuries. You can put it on above the injury and then you tighten it using the Windlass bar, and this will reduce the blood flow or stop the blood flow to the injury. There's also a pen included with this, so when you put it on, it's important to note the time because this will allow the paramedics later in the hospital to understand how long it's been on for when they come to remove it. A trauma dressing is kind of like a really large bandage. It's got a large padded area which goes over the wound, and then the actual bandage material is elasticated, so as you're wrapping it around and you're stretching it, when you let go it contracts and it applies pressure to the wound, which is going to help reduce the bleed. This is used to put over the top of a large wound after it's been packed with some of the gauze, or if it's a smaller wound it can be used directly on the smaller wound straight away without needing to pack it first. Full blankets are really important just to keep the casualty warm and dry, especially if they're outside, until the emergency services arrive. The medical shears, these can be used for removing clothing or cutting through seat belts or even cutting down a dressing if required. So just a really handy, simple pair of medical shears. There's 2 sets of gloves included. It's really important for a rescuer to kind of take care of themselves, but also make sure they're not infecting a wound if it's a big wound and they're packing it with a gauze. So there's a couple of pairs of gloves included. Finally, there's a CPR face shield, so if CPR was required on the casualty, this is a one-way valve, so when you're breathing into the patient, anything coming back out from the patient, it's quite common that they can be sick, won't then go into the rescuer's mouth, which wouldn't be a pleasant experience, and there's a risk of transferring disease that way. It also means if there's any facial injuries, you're not having to put your face directly onto open wounds, which would be not pleasant for the rescuer or the person when they come round either. So it's a really, really simple device, but really important to be included in the kit. And that's the contents of a critical injury kit. More information about all of these kits can be seen on our YouTube channels, on our social media, and they can be purchased from our website, turtlemedical.co.uk.